Good afternoon, everybody. My name is Peter Callan, and I will be your host for this afternoon's graduation and celebration. This is the fourth Career Institute graduation, and it's certainly different than all the others. We had planned to be in a big auditorium with our graduates in caps and gowns, accompanied by their families and co-workers. However, that wasn't possible because of the pandemic, so we decided to hold a virtual graduation. Regardless of where we are, nothing can take away from the pride and joy with which we honor today's graduates. So welcome to the 2020 Career Institute graduation. Today, we honor 27 graduates in a variety of fields. With today's class, a total of 104 employees will have graduated since we started the program. A little bit of history. In 2015, we identified an opportunity to meet two vital needs: to provide career advancement opportunities for our staff and to ensure that we had highly qualified professionals to meet the needs of our patients and growing health system. And so the Career Institute was established. We started with a small group of staff to be educated and trained as medical assistants and neurodiagnostic technologists. That first class was so successful, we decided to expand the Career Institute. Since then, we have trained and educated our staff for 12 different professions, including 3 new areas this year: sleep technologists, laboratory scientists, and MRI radiology technologists. As we've expanded the Career Institute, we've adhered to the same principles year over year. Choose the best and the brightest, provide them with exceptional education and training, and do it all at no cost to the employee. And it has absolutely been a success. This success doesn't happen by accident. It's a combination of dedicated, bright students whom you're going to meet later on, enthusiastic departments, and exceptional community partners. Columbia College, Moberly Area Community College, Columbia Public Schools, and JobPoint. Our sincere thanks to all of them. I'd also like to thank my many colleagues across MU Healthcare, knowing that I risk omitting some names. I would like to thank Jonathan Curtright and Mike Kohler for their ongoing support of this program. In ambulatory care, Jeanette Linebaugh, Cerisa Ward, and Tiffany Nash. In nursing, I want to thank Bridget Robbins, Joan Hornick, Dr. Mary Beck, Jennifer Brooks-Ditzfield, and Janet Thompson. In neurodiagnostic, Pam Schneiders, Tammy Heather, Donna Smith, and Jody Peterson. In radiology, Joni Shoup and Nian Trout. And the entire staff and leadership within our laboratory services. I also have to recognize the extraordinary work of my colleagues in human resources, selfishly, who make this happen every year. They select the right students, get them onboarded, track their progress, and do all the behind the scenes work to set up this graduation. So a huge thank you to all of my colleagues across human resources. And of course, thank you to our graduates. We need you. We really need you. Let me give you an example of why we need you. Our mission is to save and improve lives. Just last week, I met an elderly couple from Sedalia who seemed to be lost in the hallway. As I walked them into the clinic for their appointment, we were greeted by a former Career Institute graduate who is now a medical assistant. As I said goodbye to them and she welcomed them with a smile, all I could think was, they're in good hands, we trained her. So to all who have helped create and develop the Institute over the last several years, thank you. It is now my pleasure to introduce you to a huge supporter of the Career Institute, our Chief Executive Officer, Mr. Jonathan Curtright.
Hello, Peter, and can everybody hear me okay? All right, very good. Well, this is the 4th Career Institute ceremony that I've had the privilege to be a part of. In all sincerity, this is one of the highlights of the year. I love it that this is an incredible investment in our community and the best and brightest here we have at MU Healthcare. Congratulations on the culmination of a great deal of work. And I know that you're in for the time of your life as you embark on the next stage of your career as you join the workforce here at MU Healthcare. And I know that this is going to be an unbelievable foundation that you've invested in over time, and it's going to serve you well for many, many years to come. Congratulations and welcome. If you think about it, Peter hit a lot of the key data points. We have 8 different tracks of people that are now a part of this program. It started with 2 and it's continued to grow. And there's a few other data points that I thought you all might be interested in learning about, is that there's 27 graduates, and 25 of those graduates are current MU employees. Fantastic. This is exactly why we do this, is that we want to ensure that our team here at MU Healthcare, that they have the chance to grow and have an incredibly rewarding career. And I think you're going to find, if you haven't discovered this already, I think you'll find that healthcare attracts a truly kind, generous, altruistic, community-oriented sort of leader. And you are now a part of that. So welcome to the team. Welcome to MU Healthcare, and congratulations on your incredible accomplishment of being a member of the Career Institute. Now, 25 out of the 27 graduates are MU employees. That's exactly why we do this. Now, what are some other data points that are out there? Well, we have 3 neurodiagnostic technicians. We have 5 sleep technicians, 3 certified medical assistants, 2 medical lab technicians, 1 MRI tech, and now we have 9 RNs. This is fantastic. All of these employees, all of you, all these disciplines that you all have trained in, we desperately need these people. We desperately need your contributions to take care and ensure that we are meeting our mission and vision of saving and improving lives each and every day as Missouri's premier academic health system. Now, we wouldn't be able to do this without great collaborations. And Peter mentioned the Columbia Public Schools, the Columbia College, Mobley Area Community College, and Job Point. We are honored that they continue to serve with us. This is the 2nd year that we've worked with Job Point here in Columbia. Congratulations to the 4 certified nursing assistants that are a part of our ongoing efforts. And I'd like to personally say thanks to Steve Smith and Tanya Cook for their hard work and collaboration with Job Point and MU Healthcare. This has truly been a success for everybody involved. Now, you're entering an incredibly competitive and complex field. And for us to succeed, we need your best. We need for you to bring your best every single day. And we need outstanding employees just like you. And many of you are probably thinking to yourself, oh, I'm worried about this. What about this COVID-19 thing? Well, I'm here to tell you that MU Healthcare is growing and thriving, and we desperately need your incredible contributions. There is a place on the team for you. You're the best and the brightest that we have here at MU Healthcare. So finally, congratulations. Congratulations to you as graduates. There are many, many people surrounding you probably right now that are critical members of the team, your parents, your spouses, your sons or daughters, grandparents, and they're a part of this celebration as well. And so congratulations to you, and thanks for frankly putting up with them probably during this time where they were both working and studying. You're a key part of the team. So on behalf of the MU Healthcare leadership team, congratulations. You are going to have a fantastic career, and welcome to the team. And with that, I'm going to turn the mic back over to Peter Callen. Peter?
Thank you, Jonathan, and in particular, thank you for your enthusiastic support of this program. You mentioned how healthcare attracts a certain type of person, kind and generous, which is a perfect entry into the next section of this ceremony. It's now my pleasure that I invite one of this year's graduates to speak, Mr. Eric Kelly. Eric has been with MU Healthcare for 16 years, most recently working in our distribution department. Over the years, Eric has built a reputation for being reliable, positive, enthusiastic, and always wanting to help others. These are exactly the qualities that are needed to be a compassionate nurse. When Eric applied for the scholarship to become a registered nurse, it was a very easy decision. And did we ever make the right decision? You're going to see and hear why. It is my absolute pleasure to introduce to you Mr. Eric Kelly, registered nurse.
Wow. Hello, everybody. Thank you, Peter, for that introduction. You might went a little over the top on that. I want to send a special thanks real quick to Kim Human. She recognized and nominated me to be this graduate speaker. So thanks, Kim. Thanks for everything. Now, she knows I don't like speaking, so everyone please bear with me. Congratulations to all the graduates of the 2020 MU Career Institute programs. We made it, you know. I'm sure all of you are excited to have completed your program, and through our own journeys, I'm sure we all met some type of challenge, but we made it to the end. So if you haven't done so already, go celebrate. You deserve it. And along the way, thank the ones who helped you get to this point. You know, Jonathan mentioned that, you know, it took a lot of people. Everybody encouraged you, family members, friends, whatnot, but thank them. They helped you get to this point now. So once again, congratulations to your new success. So I completed the MU Career Institute Nursing Scholarship Program at Columbia College. What first led my interest to become a nurse was my grandmother and my father pushing me to enter the field. Imagine they saw something in me that showed I'll be successful as a nurse. They never said what it was, but I imagine it was something. And also, several years as being a nurse tech, I recognized that I could do more for my patients. So that drove me as well. When I first started taking prereqs for nursing school, I was working full time there in distribution. I was going to school part-time in the evenings. I was taking care of my 3 boys. It was difficult, but I was determined to get through it. But I knew when nursing school started, I was going to change my daily schedule. Just because nursing classes are longer, you got clinical days. I wasn't sure how I was going to manage it at the time, but I was going to figure it out. So right before nursing school was about to begin, I reached out to Bridget Robbins, the director of nursing for MU Healthcare. And she informed me that a new scholarship program was being developed and established through the MU Career Institute program. I was like, what? Sure, let me check this out. So I got the information, applied, and was accepted. And I want to say that I'm grateful for this nursing scholarship program because of the time that it gave me. Now, thanks for the money too, don't get me wrong, but mostly for the time. And what I mean is that this program allows you the time needed to dedicate to reading, to studying, to get into your classes, get into your clinical days. So how the program works, you work 16 hours a week at your current position, and the program makes up the other 24 hours to keep you at full-time status. So you keep your paycheck, you keep your benefits. I know, it was magical. I graduated from nursing school in December. I'm working on the family medicine unit in the hospital as a registered nurse now, and I give all the credit to MU Career Institute program. Thank you. Through this whole experience, I have learned that it's never too late to pursue your dream or to start a new journey. I've also learned as long as you stay focused and keep pushing forward, you can achieve anything. I have 3 pieces of advice that I give someone when they're thinking about attending nursing school. First, I ask them if they heard of the Career Institute nursing program. And if they haven't, they need to. This program provides someone with the flexibility to succeed. Second, I tell them that they're gonna need a strong support system. And we mentioned this a couple of times. And I'm sure most of you guys can relate that, you know, the program might've got hard. Through your studies, you didn't think you was gonna finish, you wanted to quit, but you had someone there pushing you, keeping you engaged in your studies, and we made it. So, like I said, you're gonna need someone, either significant other, family member, friend, neighbor, a lot of prayer, motivational YouTube videos, whatever it takes. For me, I got too many people to thank, so I'm just gonna say it took the whole community to get me through, trust me. And third, I tell them they're gonna need a why. You know, why are you doing this? Who are you doing this for? What difference would this make? Having that would keep you engaged in your studies, will keep your eye on the prize, will keep you motivated to finish. For me, it was my kids. Um, I wanted to show them that it's some hard work, some dedication, you can accomplish your goals. And also, I wanted to be an example for them and for anyone pursuing nursing, trying to further their career, that if I can do it, you can do it. So thank you, MU Healthcare, for this opportunity. Thank you for the investment you put in all of us. I appreciate all the love and support everyone's shown me throughout the hospital. Congratulations again to all the graduates of the 2020 Career Institute programs. Thank you.
Thank you, Eric. I certainly hope that your children are watching this and that they're as proud of you and look up to you as much as we do. Really, really inspiring words. Our patients are in good hands with you, I can tell, and I can see why we're already hearing about your performance, your stellar performance from the medicine department leadership. So thank you, Eric. Now it's on to the section for which our graduates and their guests have been waiting for. Normally, at this point, we would invite graduates to come onto the stage, receive certificates, and have their photograph taken. Since that's not possible, we will show a picture of each graduate and then describe where they had been working before the Career Institute and their new profession and where they are working now. The first group of students or graduates are medical assistants. These are professionals who work in our 60 plus clinics and they provide vital service as our patients come in or get seen by the physicians and help administer treatments. Let me introduce them to them. First, we have Brianna Davis. Brianna had been a service representative in our surgery clinic and is now a medical assistant in Northside Family Medicine. Congratulations, Brianna. Next, we have Amanda Wilson. Amanda worked in environmental services in our housekeeping department, and she is now a medical assistant in our medicine clinic. Well done, Amanda. Next, we have Abiba Mumbai. Abiba was a care team associate in our pediatric department, and she is now a certified medical assistant in our family medicine clinic. Congratulations, Abiba. Now on to the registered nurses. This group of registered nurses work across the entire health system and join a team of almost 1,500 other nurses in providing care for our patients from birth all the way through life. So let's meet them. First is Brianna Aguilar. Brianna had been an LPN in our family medicine clinic, and she is now an RN in the El Special Oncology Unit. Congratulations, Brianna. Debbie Fremantle. Debbie was a care team associate in our medicine department, and she's now a registered nurse in that same department on our medicine area. Congratulations, Debbie. Jessica Van Loo had been a business support specialist in surgical services, and she is now a registered nurse in the cardiac intensive care unit. Well done, Jessica. Congratulations. Sarah Henderson Barber had been an LPN in our surgery clinic and is now a registered nurse in the El Special Oncology Unit. Congratulations, Sarah. We just met Eric Kelly, but we'd love to meet him again. Eric, as he had said, had been a distribution tech in our warehouse area and is now a registered nurse in our family medicine department. Congratulations, Eric. Congratulations, Kelly. Kelly Snodgrass had been an LPN in surgical specialties and is now a registered nurse at the MOI Orthopedic Hospital. Brianna Early had been an LPN in the medicine clinic, and she is now a registered nurse in the orthopedic department. Congratulations, Brianna. Donna Stevenson had been an LPN in our ENT clinic and is now a registered nurse in our medicine department. Well done, Donna. And last of the registered nurses, Cassie Wilbanks. Congratulations, Cassie. Cassie had been an LPN in Ellis Clinics and is now a registered nurse in the Ellis Fischel Oncology Unit. Congratulations to all of our registered nurses. Next, we're going to see two medical lab scientists. Our lab scientists perform vital services across our lab areas, helping to diagnose disease and treat disease, vital to our organization. Let's meet them. Congratulations to Amanda Embry. Amanda had been a medical lab tech and is now a medical lab scientist in our blood bank. Sean Maridi had been a medical lab technician and is now a medical lab scientist in our clinical lab. Congratulations to both Sean and Amanda. Well done. Next is new for us this year. We have an MRI technologist. MRI technologists provide vital services in the help to diagnose disease and also to determine how well treatments of disease are progressing. So let's meet Carly Nelson. Carly Nelson had been a radiology technologist and will now be an MRI technologist in our radiology department. Congratulations, Carly. Sleep technologist is also new for us this year. They also perform diagnostic services both on an inpatient and outpatient basis. And let's meet them. Congratulations, Aaron. Aaron Betts was a medical office assistant in the bariatric clinic, and he is now a sleep technologist in the adult sleep lab. Ashley Bunting had been a pharmacy technician at the University Hospital and is now a sleep technologist in the adult sleep lab. Congratulations, Ashley. Haley Hewer had been a pharmacy tech at University Hospital and is now a sleep technologist in the pediatric sleep lab. Congratulations, Haley. And Emma Kiundi. Congratulations, Emma. Emma had been a certified medical assistant in our pediatric specialty clinic and now works in the pediatric sleep lab. Congratulations to all our sleep technologists. Related to sleep technology is our newer diagnostic technologist, and we've got 4 of them. This is a program that we've been having since the very beginning. So we are getting very, very good at developing and training neurodiagnostic technologists. Let's meet this year's graduates. Ashley McWilliams. Congratulations, Ashley. Ashley had been an office support specialist in the MOI operating room and now works as a neurodiagnostic technologist. Kara Jackson. Congratulations, Kara. Kara had been a patient access specialist and is now a neurodiagnostic technologist in the clinical neuropsychology department. Autumn Cochran. Congratulations, Autumn. Autumn had been a pharmacy technician in the pharmacy outpatient area and is now a neurodiagnostic technologist. And the last of this group is Chelsea Smith. Congratulations, Chelsea. Chelsea had been a mental health technician at MUPC and is now a neurodiagnostic technologist in our clinical neuropsychology department. Congratulations to all our neurodiagnostic technologists. And lastly, our certified nursing assistants. And certified nursing assistants, sometimes called CTA support and patient technicians, are the people who are closest to our patients. They provide that vital care, that vital touch to our patients at all stages of their lives and their hospital stays. No hospital could ever survive without this group of people, certified nursing assistants. Let's meet this year's graduates. Janice Fordyce. Janice, congratulations. Janice had been a staff assistant in Ellis administration and is now a care team associate in our medicine department. Samantha Grosclose is now a patient care technician. Samantha came to us through our collaboration with JobPoint, and delighted to have her. She is now working in our new integrated medicine department as a patient care technician. Ian Robertson had been a hospital security officer and is now a mental health technician at MUPC. Congratulations, Ian. And Elizabeth Weiss. Elizabeth is also new to our organization, coming from our collaboration with JobPoint, and Elizabeth is now a patient care technician in integrated medicine. Congratulations, Elizabeth. If I could right now, I would do a virtual applause. Congratulations to all of our graduates. You should be very, very proud. We are certainly proud of you. As Jonathan said at the beginning, he said this is one of his favorite days. I enjoy my role here and I love coming to work. However, the day that we hold the Career Center graduation is easily my most favorite day at work for the entire year, just because I know that we have now 27 new extraordinary people taking care of our patients, and nothing gives me more joy. Congratulations to you all. Now, I would like to introduce our next speaker, Mr. Mike Kohler. Mike Kohler is MU Healthcare's Chief Administrative Officer. In addition to many other responsibilities, Mike is the executive sponsor of the Career Institute and one of its biggest cheerleaders. Mr. Mike Kohler.
Thanks, Peter. Hello, everyone. As Peter said, my name is Mike Kohler. I'm the Chief Administrative Officer here at MU Healthcare, and I want to echo the congratulations to all of this year's graduates. I'll also echo what Jonathan and Peter have said. This is really one of the best days where we all get to come to work and celebrate all of you. So I'm so proud of each of you for the time and the effort that you've put into advancing your career. All that hard work will definitely be worth it. As you know, the mission of our Career Institute is to provide career development opportunities for our staff, but it's just the start of your journey. Though we're celebrating the completion of your training, your learning is far from over, and there are two things that come next with your learning. First, your next step is to seek out mentors who can guide you on your way to becoming the best in your fields. Talking with Eric Kelly right before this ceremony, he talked about how important his mentors have been, and I know that to be true. Second, a crucial part of learning is actually educating others. I know that the training you received through our Career Institute was top-notch. Now, as you gain experience on top of that training, please take time to work with your colleagues and provide leadership, provide instruction to your fellow employees, help others succeed as well. You have a tremendous opportunity to change lives by working in healthcare. Please know that our entire health system is proud of you. We are here for you. We're here to support you and encourage you as you grow. Finally, in this fourth year of the Career Institute, with actually 104 graduates to date since we started the Career Institute, it's so important that we continue to use this program to create a more diverse and inclusive workforce. I'm happy to say that through this program, we will continue to create more opportunities for people from underrepresented groups in the coming years. I thank you for your dedication to saving and improving lives, and I want to thank the leaders like Peter and Kim Human and the staff who make the Career Institute possible year after year. Thank you all so much, and again, congratulations to our graduates.
Thank you, Mike. This brings us towards the end of our program. If we had been in an auditorium, no doubt we'd be inviting you for a cake and punch right now, but we are online. So once again, congratulations, graduates. You should be very, very proud of yourself, and your families and those who love you should be very proud of you. We are certainly proud of you. As I said earlier, our mission is to save and improve lives, and having you on our team in your varying roles will help us achieve that mission. All I'll ask of you is that you continue to learn and grow, keep patients at the center of everything that you do, and be an inspiration to others who will want to follow in your footsteps. Congratulations and well done. This concludes the program. So glad that you were able to join us to honor the graduates of the Career Institute 2020 class. I look forward to seeing you at next year's graduation, hopefully in person. Until then, take care, keep 6 feet apart, wear your mask and wash your hands, and goodbye.